In this video, we'll guide you through the essential medical and health preparations you'll need to focus on before making your move abroad.
Moving to a new country is an exciting adventure, but it comes with a lot to think about, especially when it comes to your health.
Health is a cornerstone of a successful relocation, and ensuring you're prepared can save you from unnecessary stress later on.
And stay tuned because we've prepared a detailed step-by-step checklist for moving abroad covering health, documents, and finances that you can download completely free. We'll explain a bit later.
Hi, we're Antonieta and Francisco, and this is A and F Beyond.
First up, schedule a comprehensive medical checkup before you leave. Talk to your health provider about any ongoing conditions and update your vaccinations based on your destination's requirements.
Some common ones to look out for include hepatitis A and B, typhoid, or even malaria prevention if you're moving to a tropical area. This step is crucial for avoiding surprises later.
This step is so important. You want to make sure that you're reasonably healthy before departing to your new destination. If you have any medical issues, you can decide whether to take care of them in your home country or in your new country. Just be aware that most, if not all, international health insurance plans do not cover pre-existing conditions, and many have a 1 to 2 year wait period before they cover you for things like cancer.
Next, let's talk about medications. If you rely on prescriptions, try to secure a 6 to 12 month supply before moving. You can find most medications all over the world, but you don't want to take chances and run out.
We're very lucky that in San Miguel de Allende, where we live, we have access to shipments from the States. We have a United States address with a forwarding service that brings our packages and mail down, including medications that we order online. We don't know if this is true everywhere.
Yeah, I don't know if you can do it everywhere, but here with the service that we have, you can have your medications shipped from your pharmacy to the P.O. Box in Laredo, Texas. And then this service brings it to you with your mail and also any other goods that you buy on Amazon or whatever. And of course, there's a yearly fee and taxes on things that you buy on Amazon, for example. And then the medications they bring down for free.
Now, does that include prescription medications if you were to get something online in the States?
Yeah, I mean, you can have, like I said, from any pharmacy, you can have it shipped to Laredo. And then at that address, the service brings it to you here in San Miguel.
Our service does allow the importation of prescription meds?
Yes, of medications. Mm-hmm.
That's awesome. And don't forget to ask your doctor for a written prescription list. Be sure it includes generic drug names because brand names can vary internationally. And if you end up with a prescription with a brand name on it and you go to a pharmacy and try to get something that you know is the same medication but under a different name, the pharmacy will not sell you that medication. We learned that on our recent experience when we went to Mexico City for Antonieta's surgery, and we had a prescription with the brand name on it, and they had other equivalent prescriptions and they just would not sell it to us. So we had to contact the doctor and have him write another prescription, and it was just a hassle. So take it from us and just get the generic name.
Also, double check local regulations to ensure your medications are legal in your destination. You don't want to get caught off guard at customs. Be especially careful if you plan to travel with medical marijuana. Even if it's legal in your destination country, it may be illegal to import it. For us, we typically purchase medications out of pocket.
Now, health insurance. Review your current plan to see if it offers international coverage. In most cases, it won't. If it doesn't, consider purchasing international health insurance that includes benefits like medical evacuation and repatriation. Check the fine print though. Some plans will repatriate you to the country of residence, not necessarily your home country. If you're from the United States, for example, and you're living in Mexico, you'll be evacuated back to Mexico from a third country, not back to the United States. In our own personal case, our deductible is so high, it's $5,000 a year. And so there are years where we'll go many years in a row without meeting that deductible, that trying to get reimbursed for every medication that we purchase is really not necessary, because the other bonus that our insurance gives us is if we don't claim anything for 3 years, then they waive the deductible for the 4th year on.
Once you're settled into your new country, if you don't plan to do much international travel, explore local health insurance plans in your new country. These are often more affordable and tailored to local healthcare systems.
We've prepared a detailed step-by-step checklist for moving abroad covering health, documents, and finances that you can download completely free. To get your copy, just type checklist in the comments below and we'll send it your way.
Vaccination requirements vary by country. For example, some destinations require proof of yellow fever. Be sure to carry your international certificate of vaccination, also known as the yellow card, and think about preventative treatments like anti-malarial medication if needed. This is only if you're going to be in off-the-beaten-track countries. Be sure to check the vaccination requirements of the country you're headed to. Before you move, visit your dentist and optometrist for a checkup. Update your prescription for glasses or contact lenses and buy spares. If you have a light prescription and you're headed to a country like Mexico, for example, you can find very inexpensive glasses. Just be aware that the selection might be limited.
You're out of luck with this one.
I'm out of luck with this one because I was born with complicated eyes and I have really bad vision in my right eye. So having glasses made in Mexico is virtually impossible. I've tried, they can never get it right. After about 6 tries this last time with a doctor who is in Querétaro, not even from San Miguel, but in Querétaro, they never got it right. I had to go back to my optometrist in San Francisco and they made my glasses in the very first try, and it's the one I'm wearing right now, and they were perfect. So I didn't have any issues. So unfortunately, if you have a really complicated prescription, you might not be able to get your glasses in Mexico.
You can try, it's worth the try.
Yeah.
It's not expensive, so you're not gonna be wasting too much money.
They gave me all my money back when they realized that they just weren't having any luck with the lab and they weren't able to make glasses. So they gave me 100% refund, and all I lost was time.
And if you need any major dental work, it might be worth doing it before your move, if your insurance covers it. Costs and services can differ significantly abroad. Before we left, I had my 2 fillings replaced. Living in Mexico, I can tell you that dental care is excellent and affordable here, but you need to shop around. Use local resources like Facebook expat groups, for example, to find reputable dentists. You can also ask around. By talking to locals, you'll discover their favorite doctors.
An emergency healthcare kit is a must. Include essentials like pain relievers, antihistamines, antidiarrheal medication, band-aids, and a thermometer. It's good to have these during your travels, and once you get to your final destination, have an emergency health kit in an accessible place of your new home.
Tailor it to your personal needs and destination. It's always better to have it and not need it than to need it and not have it. This might seem like common sense to some of you, but we're just pointing it out here just to facilitate your moving process.
Moving abroad can be stressful, so don't forget about mental health. Research therapists or expat support groups in your destination.
Virtual therapy options like BetterHelp can provide continuity of care no matter where you are, and planning self-care practices will help you adjust more smoothly.
And FYI, the cost for a 1-hour therapy session abroad is much less expensive than in the US. You'll find English-speaking therapists for the price of your copay in the United States.
Familiarize yourself with nearby hospitals, clinics, and pharmacies. Research how healthcare works in your destination, including whether you'll need to pay upfront for care. Hospitals often require payment in full upon completion of service. This includes operations and emergency room visits.
If you do not pay, you may not be allowed to leave unless the hospital has agreed to collect from your insurance company and the insurance has approved payment. And if language might be a barrier, identify facilities with English-speaking staff or have a reliable translation app handy. If you have allergies, chronic illnesses, or dietary restrictions, research how they're handled in your new country.
Carry an allergy card in the local language for food or medication allergies. It can be a real lifesaver.
Travel insurance is your safety net during the transition. Look for a policy that covers health emergencies and trip interruptions.
Always keep both printed and digital copies of your policy accessible during your journey. If maternity care or family planning is relevant to you, research the resources available in your new country to ensure a smooth transition.
Continuity of care is key, so plan ahead to avoid any gaps in service.
And there you have it, your guide to medical and health preparations for moving abroad.
With these steps covered, you'll feel more confident and ready to embrace your new adventure.
And don't forget to get your free checklist by typing checklist down below in the comments.
And if you found this video helpful, give it a thumbs up, subscribe to our channel, and let us know your questions or tips in the comments.
Thanks for watching, and we'll see you in the next video.
Bye, everybody. Hi, we're Antonieta and Francisco, and this is an A and F Beyond.
It's not an A enough.
Okay, last take.
Get it right?
All right.
If you can screw up, you got to do it again.
I'm not gonna.
And many have a 1 to 2 year wait period before they cover you for things like cancer. We need to kill that fly.
Okay, keep going. We're not gonna kill him now.
If it doesn't, consider purchasing international health insurance.
This fly just landed right on my face.
Damn.